Nitroglycerin. For this infusion, we will need a 100 milliliter bag of D5W, a Sapphire pump 20 drop set, one vial of nitroglycerin containing 50 milligrams in 10 milliliters, a blunt film needle, and an alcohol prep, and a 3 ml syringe. To start, remove the cap from the medication vial. Clean the rubber top with an alcohol prep. Assemble your 3 milliliter syringe and blunt film needle. Withdraw 2 milliliters, or 10 milligrams, of nitroglycerin into the syringe. Inject the 2 milliliters of nitroglycerin into the 100 milliliter bag of D5W. Safely dispose of the needle and syringe in a sharps container. Gently mix the medication by tipping the bag back and forth. Spike the bag of medication with a Sapphire pump drip set. On the back of the cassette, we can depress the flow stop tab that will allow the D5W to flow through the drip set. Once all of the air is expelled, we can release the tab and stop the flow. Open the cassette chamber door. Next, we will install the cassette into the chamber. Place the forks on the bottom of the cassette into the pins and pivot the top of the cassette into the pump. You will hear an audible click when the cassette is properly attached to the pump. Close the cassette door. It will latch shut. Tap the on-off button. The pump will run through a brief warm-up and self-test. Notice the clinical care area, adult or peds. To change the clinical care area, select Change on the bottom left and select the appropriate clinical care area. To accept the clinical care area as shown, tap Accept. Select Preset Programs. Select 2, Nitroglycerin. On this screen, we can verify all of the information entered is correct. Our medication we are administering, the rate of infusion, volume to be infused, and the time at which it will take to infuse the medication. If all of this information is correct, tap Next. We now confirm that we have prepared 10,000 micrograms of medication in 100 milliliters of volume. Tap OK. Tap Start to start the infusion. Now we will give the patient a bolus of medication at our prescribed 400 micrograms over 5 minutes. Tap Bolus. Select Amount Bolus. Per EMIHS, we always select the number in red on the right-hand side. For this example, type in 400. Select OK. Select Dose Rate. Again, we always select the number in red on the right-hand side. For this example, type in 200. Select OK. Notice the time of our bolus is auto-calculated to 2 minutes. Select OK. We now get a confirmation that we are going to be giving a bolus administration of 400 micrograms in 4 milliliters of volume. Select OK. The pump will now administer the bolus of medication. We know this because on the screen it shows bolus. Once the bolus has been delivered, the pump will automatically return to an infusion rate of 40 micrograms per minute. If after 5 minutes you do not achieve a 20% reduction in systolic blood pressure, per Maryland Medical Protocol, we can increase our dose of nitroglycerin by 5 micrograms. To do this, tap the large 40, which is our dose rate. On this screen, we can simply enter 45 to increase our dosage to 45 micrograms per minute. Tap OK. We will continue to increase our dosage every 5 minutes until we reach a 20% reduction in systolic blood pressure, or to a maximum of 80 micrograms per minute. The opposite is true as well. If we have a decrease greater than 20% with our loading bolus and 40 microgram per minute infusion, we can decrease our infusion dosage to 35 micrograms per minute, and so on with our reassessments. We do not stop a nitroglycerin infusion, as it always needs titrated down first. This is why we must consult with the receiving facility prior to arrival to allow for the continuum of care in a timely manner.